Hello, this is Dr. Kevin Connors.
And Michelle Hamburger.
And today we're going to talk about chemotherapy and peripheral neuropathy. So do we get a lot of people complain about that?
Yes, so the majority of the patients that start with Connors Clinic have either already gone through the traditional system and have done chemotherapy and radiation, or come to us at a late enough stage or their cancer is significant enough that they choose to do chemotherapy. And peripheral neuropathy or chemo-induced peripheral neuropathy is incredibly common and can be very debilitating. And so we are asked often, what is it that a patient can do naturally to help either prevent some of those effects or eliminate them once they've already come into place. We had a patient just yesterday tell me that her oncologist said that if her peripheral neuropathy had not abated by a year in, that she would never, ever have relief from it for the rest of her life. And so just wondering if you can comment on that and what it is that our clinic can do to support patients in this.
Well, I put up this picture on the slide here because I wanted to relate it back to what we were talking about with some other members' minutes just recently about oxidative stress. What chemotherapy is an oxidizing agent, and oxidizing agents damage cells. Well, that's the goal with chemotherapy. We want it to damage cells. We want it to be a poison to cancer cells. But the problem is, it's not just a poison to cancer cells, it's a poison to other cells as well. And when it damages neurons, then you end up with neurons that are dying, and then pain is not, and pain and tingling and different types of pain that you get with neuropathy, like burning pain and tingling pain, those things are no longer inhibited because the fibers that typically inhibit those pain sensations have died off because of the oxidative stress caused from the chemotherapy. So we talk about chemotherapy-induced peripheral neuropathy. It's because the chemotherapy has basically killed neurons that are supposed to be inhibiting these pain sensations. So we talked about that we don't want to just load up on high-dose antioxidants when we are currently doing the chemotherapy, because we want the chemotherapy, that oxidizing agent, to effectively kill cancer cells. But about 48 hours after chemotherapy is done, after our infusion, that's when we can use detox therapies to help pull that out so it does less damage on other parts of our body, other cells, including neurons. So if it's killing neurons, it's killing other cells too. So we've had patients, literally family members, get autopsies of past patients who passed away, proving that they ended up passing away from chemotherapy-induced cirrhosis of the liver. Well, how would that happen? Well, because chemotherapy kills cells. It doesn't specifically only target cancer cells. It kills your healthy cells as well. So, are there things that we could do post-chemotherapy to help preserve and protect healthy cells and healthy neurons, and to also, if I already have neuropathy, to regenerate those neurons and your other cells, including your liver and all your other cells in your body? Can we regenerate those to regain a level of health that we are currently lacking? And that's where we want to talk about some of the therapies. So you can speak about a few of these, Michelle.
Sure. So one of the benefits with the Ion ProWave, and part of the reasons why we have patients doing this as part of their chemotherapy protocol, is the benefit of extracting excess toxins from the body. Toxins can damage cells and their ability to function. The toxins in chemotherapy, as Dr. Connors was just saying, will actually kill those cells. And so once you are finished with your chemo, or if you are doing a chemo protocol, running the ion ProWave is going to draw out some of those excess toxins that have no longer served or are done serving their purpose, and you don't need them in your body any longer. And you can draw those out so that they are no longer affecting your cells in a toxic or oxidizing manner. So the ion ProWave is excellent. Secondly, the PEMF. The PEMF is a phenomenal cellular regenerative device that we have seen excellent results in. We've had several patients that deal with peripheral neuropathy that have had a great relieving of their symptoms and have seen correct sensation come back into their hands and feet by doing the PEMF. If you have access to one of these in a clinic near you, or you come to Connor's Clinic to do PEMF sessions, you would request that the pads be put either underneath your feet or underneath your hands, and so that you're concentrating the bulk of the delivery into the appendages that are most affected by the neuropathy. Do you want to?
And the Rebuilder is another picture we have on this slide. That is a electrical stimulating device that has FDA approval for neuropathy, and that's where you can put the pads, sticky pads. It kind of looks like a little TIMS unit, but it stimulates at the frequency of the nerve. That's why it can be so helpful to rebuild a nerve and to help that regrow and strengthen, and it's been proven to be excellent for neuropathy. Typically we do it with the pads in a bucket of water, and we can give you instructions on how to do that. That is an FDA approved device. I put up a picture of niacinamide B6. Actually, we should use the B6 niacinamide. I noticed as I look at this that that's the wrong picture, but that is another supplement. There's a whole bunch of other supplements that you could use to help detox. You could use chelators to help detox that. You can support the liver detox pathways, and most certainly with our patients, we run a genetic profile because we want to look at the PON pathway, the NAT pathway. These are specific genetic pathways that if a person has defects on that pathway, they're going to be more susceptible to negative effects of chemotherapy, and most certainly we want to more specifically support those pathways. So hopefully this gives you a brief understanding of, yes, you can help rebuild those neuron pathways. Yes, you can help detox the negative effects of chemotherapy out of your body. But the longer you do have the damage, the longer it's going to take to rebuild that. So you want to jump on this as soon as possible.
Thank you very much.
Bye-bye.